Violence reduction. I mean, zero seclusion, or reducing seclusion. Seclusion is a response to real or potential violence, I would imagine. Do you ever seclude anyone for any other reason?
Not anymore.
Not anymore. So, fair point. I can imagine what you're driving at. But yeah, perceived potential violence, perhaps, or whether it's ever been used for punishment, who knows? But anyway, so when we're talking about violence reduction strategies and thinking about what may be the causes of why does violence occur, and it's very relevant to what you've just been thinking about, I guess. That is in turn relevant as to why seclusion might therefore be required, or in our case, and again I was discussing about the fact that in Scotland we don't have seclusion, just because we've never had it. Taking something away that you've had is actually much harder than if you've never had it. Well, you don't miss it, as it were. So, reducing restrictive measures of all sorts, which tend to be around reducing violence. So the things when we're thinking about violence reduction, we are at the same time, I'm quite sure, going to be discussing and thinking about what may result in less seclusion. So, having stood up, I'm going to ask you a question, which is to discuss at your table just for a few minutes a few thoughts around what are the things that lead to a violent situation arising, and then we can discuss further. It's good that there's obviously a lot of discussion going on, and I think the reason I asked you to think about it is because obviously we've been thinking about it. We've come up with a few thoughts of our own in Scotland, and we have some evidence of some of the things that do work, and I'll talk you through them. And then back to some more discussion. So you're going to hear about driver diagrams. Now, the experts in the room will tell you that this is a very poor driver diagram, because it's all squinty. But a driver diagram, as you'll hear, is about doing just what you've done, thinking about some kind of outcome, i.e. violence, and thinking about what are the key things that might contribute to it. Why would it occur? There's maybe big picture stuff. And just to talk you through this a little bit, I'll take my specs on. Well, I'll turn this way. So the big picture things, and we were just talking about the environment in north of here, a unit where you go in and it's through a kind of back entrance and there's bins and mattresses there, and you're going into what looks like a prison. So I guess if you're disturbed, distressed, confused, that's not going to help you calm down. So environment, and I don't know, is that common around the room? People think about environmental considerations as to why violence occurs. Maybe within the ward there's poor visibility. Poor opportunity to observe people. I don't know, I'm sure you came up with thoughts around how the environment affects you. I guess if a place feels airy and nice and pleasant, we found when we moved to our brand new hospital, which we did about 6 years ago, and it is airy and light, but also people were quite respectful of the fact it was brand new. They didn't kick the doors and stuff because it looks nice. So a pleasant and suitable environment is undoubtedly a factor. So that's one thing. In no particular order, a focus on care, treatment and de-escalation. Again, at our table we were talking about different staff having different attitudes or different sort of kind of automatic reactions to things. And why might that be? Why might some staff feel more comfortable with trying to engage with a person than another? It might be, well, again, when we were in the Wellington area, it was put very clearly to us by the charge nurse there that he felt that variation in levels of seclusion and violence incidents were about staff confidence. And that was confidence both in themselves, but also confidence that they were supported, that the doctor would come and prescribe something if they needed to, that help was there. We also saw, well, I saw seclusion rooms for the first time ever, which was quite interesting. I wouldn't like to lie in one. So the focus on care, treatment, and de-escalation as a factor. So how focused you are on that. Again, this is not a perfect set of list. Your list is as relevant as this one. This is just one that Jonathan came up with, actually, who's my pal. Leadership, again, that's back to confidence, I suppose, people's expectations. And again, I hope you don't mind me telling this story, because again, it was a very interesting story. That the decision was made in developing a new unit in a particular part of New Zealand to have no seclusion room, and in the run-up to the new unit, seclusion didn't happen. and everybody was okay about that, or the staff were okay about that. And again, you can speculate as to why the managers then said, "Oh, wait a minute, no." The room that was designated as a sensory room was redesignated as a seclusion room. So seclusion, which had disappeared, came back. Well, there are managers here who might think that's terrible, or managers here who might think, well, I can understand maybe. I mean, I know, and again, maybe I don't know if it's a touchy subject, but industrial action, managers thinking, oh, if we don't have a facility and then something bad happens, maybe I'll be the one for the chop, So again, I suppose that's where some of that discussion about the alignment of aims at all levels. Staff might have a great idea, but the manager's got to be able to support it, and the manager above that. So we've all got a role in this kind of change process. Response to related adverse events, again, thinking about when it's gone wrong. How do we respond? Do we go back to being more risk averse or not? So, and across over here, and again, when you see proper driver diagrams, there's maybe more specific things that relate to these broader drivers. So things like, well, do you see aggression and violence as a sign of distress, or do you engage with the person to try and find out? And again, depends what's going on, depends on your experience, how much you might do that. I mean, a range of things there to mention. Promoting meaningful therapeutic activity and occupation. That's one I'm going to just allude to in a minute. Again, why does boredom lead to violence and aggression, and therefore to seclusion? How might you know? Well, again, this is where quality improvement stuff comes in. Study the pattern, and it might give you a clue as to which of these are relevant. Again, sorry to keep going back to what these guys said, but it's a rich information I just heard here, talking about the fact that seclusion rates would go up. And again, we're talking about recent violence, but I'm putting them in the same sort of compartment, really, but would occur at a changeover of shifts. Why might that be? Is that something that I see a few nods? It's maybe back shift, night shift coming on, fewer nurseries, I don't know, and so for a short period you've got more staff, somebody who you think is at risk of becoming violent, so let's just do it now when we're all here. That was what you described, guys, wasn't it? Yeah. So again, understandable, a human response, but again, something which once you've identified that, if that is truly the pattern, and you get your line graph out and you divide the day into sort of hours of the day and see when there's a peak, and if that's the case, then as in the profound knowledge thing, that's information, but knowledge is understanding it. It's understanding why that's the case, and that's maybe one explanation. Maybe there are others. Certainly, staffing levels, you would imagine, might be a factor in incidents of violence happening. So and skill mix, obviously. So yeah, use of data is one. So in terms of solutions, I mean, I think you probably were talking about, well, so if we understand these are the things that might lead to violence, there might be some simple solutions. Tidy up that entrance, make the place look less like a prison, have alternatives, have staff that are well trained, have events like this so people can think about it. Is clearly got to have an effect. But measure it. So use of data. I won't touch on others. So here's one solution that we came up with from some tests of change in Scotland. You have this in New Zealand? This is cup of tea and toast. Tea and toast. And again, it was in Ayrshire. The unit there studied their rates of it was use of restraint, which again almost universal is because of someone becoming aggressive and agitated. So patients being restrained. So they were trying to reduce the level of restraint, and it was an intensive psychiatric care unit, and which. It functions pretty well. It's quite a nice facility. I've been there many times. But they decided, well, in order to sort of reduce restraint, let's study it really carefully. So they did that. They looked at it by hours a day, again, thinking it was more to do with staffing levels, etc. But it became very apparent it was the evenings and Saturday afternoons. And these were people who really were quite ill. Some forensic, we have mixed units where people can be disturbed as well as maybe under a legal order, so difficult mix actually. But anyway, so they weren't really allowed out much, if at all. So it became very clear that boredom was a big factor. So they introduced a kind of supper club, and you had tea and toast, and it was clearly part of the program, and the rates of restraint and violence decreased significantly because those were the times when they had been high. So, and they wrote it up, they did it properly. They started off with, I think, they measured the impact of this intervention. I mean, this is QI, improvement science, but it's tea and toast. So it was an effective intervention which resulted in reduction in violence based on understanding the data and really boring into it. So, other examples which we can maybe think about, the prediction tools. I guess, is violence a consequence of things that have happened before usually? Yes, it's something that's, there's usually a lead up. Does violence ever just come out of the blue, do you think? Well, it may take you by surprise, I guess, but evidence, and I'm talking now sort of research evidence, and it suggests that more often than not, and hence there are tools where you can measure what's going on and someone's risk of becoming violent at a certain point in time. Now, obviously, there are things that are not so useful, which sort of focus entirely on static factors, i.e. historical factors that are never going to change. This man's been violent in the past, therefore he's at risk of being violent now. Yeah, but we know that he's violent when frustrated because he's not allowed a cigarette. We talked about that. Or when has violence occurred? So the Brosset violence and aggression prediction tool is one which focuses more on dynamic factors. So again, in Scotland, people have done work around using prediction tools to then, and where they've been used consistently and well, they can help reduce violence. So I guess this approach, thinking about what are the key factors in leading to these adverse incidents, and behind that, what are the more specific factors, and then, as we'll come into driver diagrams, you talk about actual change interventions, things that you might have an idea about. So I guess what I'm saying is that there are lots of different ways of getting, of approaching this, all equally relevant, and depending on the circumstances in the place, you take your pick, really, I suppose. And within the QI methodology, that's great. You can have an idea that's not even on here. You're allowed to have your own ideas, and then you try out, test it. If it doesn't work, if the supper club hadn't worked, then I guess they would have to think of something else. But it did. I was very pleased to see at the back of the room that Elisa and Neil's paper from Fife is up there. Obviously done your homework, as I knew. And it was a very specific work, reducing restraint, published in the BMJ in Fife, and the kind of things which I'd encourage you to have a look at this paper. That they identified exactly what's up here. They found it about level of engagement, boredom as a factor, etc. It's in the paper there. A piece of work in Scotland I'd just maybe flag up, and I know that Clive, when he was over in Scotland, spent a bit of time with my colleague Mark, who's a senior forensic nurse. The whole issue about how people are observed and engaged with, in fact, the whole idea of observation, and I think I've discussed with folk around in my travels already, has been a real focus, and on the back of work to reduce restraint and seclusion, it's led to quite a fundamental challenge about observation, because at the moment, or the policy up until now, it's just changing in Scotland, is that you can be closely observed or discreetly observed, or sort of 3 levels: one where you're standing right next beside somebody, one where you're always in an eye line, and it's really you're put into a category. But this new challenging improving observation practice work has led to abandoning that, and it's been tried out in various places, and it's all about an individualized plan to engage with that person. So it was scary for the staff, but I think it's a great piece of work. I mean, I'm not taking any credit for it because my colleague Mark has led it. But again, the process was one of, I think, this is probably much closer to proper co-design at the beginning about what was working, what was better in terms of when people engaged with me. It was then tried out and tested, and the evidence that it has reduced violence and aggression is becoming very apparent. So again, related to that, the way that people are managed and treated. One of the things about this kind of work is that it's very, very important that you do keep the end in mind. Reducing seclusion in itself is good. Making people feel safe and secure and confident in treatment, because I think engagement with services, and that was a very powerful description of what it's like to come into a unit that looks like a prison and you're in the back door. If we are to value ourselves as practitioners, the consumers that we are here to help, then I think we've got to keep in mind it was about making it all better. So anyway, another little. Anyway, that's me. Thank you.